Good day, fellow learners. Once again, this is your mentor, your fact check buddy, Gapuz, joining you for this teaching and learning session that is very unique. And it's the first time that we're going to use it in our YouTube channel, and it's called PECHA KUCHA. Now, a lot of you would be wondering what is a PECHA KUCHA. So the primary purpose of a PECHA KUCHA within the context of test preparations is that I will highlight concepts that you need to remember specifically for those topics that you need to master for your test. But before we engage, may I ask you, and may I share with you rather, what a PECHA KUCHA is, okay? So it's actually a storytelling strategy that utilizes 20 slides with each slide being commented on for a maximum of 20 seconds. The method would usually last for 6 minutes and 40 seconds. And that's a challenge because within that specific short period of time, I should be able to highlight what you need to remember for your test related to a specific concept. So before we start, may I ask you to join us in this mission. Our goal is to provide free NCLEX-RN application and review to 100 nurses, and to help us achieve this, just watch and finish the ads in our videos. Thank you for doing that in advance. So here we go. Let's begin with our first PECHA KUCHA. Here we go. So the first is actually airborne precautions. Now, when we think of airborne precautions, it is important for us to remember that this is usually indicated for conditions like, remember, MTVS. So measles, tuberculosis, varicella, and of course, SARS. Now, it's very important also to note that when we are implementing NCLEX for measles, it's very important that you have to remember that the first sign is high fever, followed by the 3 C's. Now, when we speak of the 3 C's, you have your cough, conjunctivitis, and coryza or colds. Now, notice that the rashes would usually be a little more heavy on the face and then the neck. Next, tuberculosis. We need to implement airborne precautions, and they are considered as the priority for the provision of a room with negative airflow. And it is important also to note that patients with tuberculosis should only be placed in a room with another patient with the same diagnosis. Next, droplet precautions. This is very important for us to remember, especially if the patient has influenza or when a patient has pneumonia. And remember, BIP. So it is indicated for bacterial meningitis, influenza, and pneumonia. Now, for patients with bacterial meningitis, on the other hand, pay particular attention that they would usually have petechial rash, and we need to implement droplet precautions. To compare that to a patient with viral meningitis, patient with viral meningitis is placed on standard precautions. Next important thing that we have to remember would be a patient with influenza. Now, take note, we need to implement droplet precautions, and the vaccine can be given to pregnant patients and even to patients with allergy to eggs. However, it is contraindicated to patients with allergy to gelatin, antibiotics, and if the patient has Guillain-Barré syndrome, they need to talk to their physician. For contact precautions, this is usually indicated for patients with diarrhea, like for example, when they have norovirus or norwalk virus or rotavirus infections. These infections would cause diarrhea, and so we have to implement contact precautions. It's also indicated for RSV, scabies, and head lice. Now, MRSA, or otherwise known as MRSA, now the most important thing that we have to remember here is that the patient should maintain good hygiene and avoid sharing razors as well as towels. And the first line of treatment would usually be your trimethoprim sulfamethoxazole. Okay, so that's what's important. Next, for standard precautions, remember, this is indicated for all patient care. And if a patient has hepatitis, they are usually placed under a standard precaution. So it applies to blood, all body fluids, excretions, and secretions, except for sweat. It's also indicated for patients with non-intact skin and mucous membrane. So it's very important also for us to remember about plague. Take note that the outstanding characteristic would be bleeding skin, which will turn the skin bluish or black. Now, we have to implement standard precautions for plague. And of course, avoid exposure to infected animals. Next, shigellosis. is a form of diarrhea. The patient would usually have bloody diarrhea that could potentially lead to dehydration, and therefore it's usually treated with oral antibiotics like ciprofloxacin and, of course, the very common azithromycin. And next, let's talk about Legionnaires Disease. Okay, this disease got its name in the 1976 Great American Legion Convention, where almost 200 people had pneumonia symptoms. So Legionnaires Disease is a type of pneumonia, so we expect that the patient will have fever, cough, body aches, and accompanied with diarrhea. And this is usually spread to contaminated water. Next, rabies. This is associated with bites of animals like cats, dogs, bat, and even your raccoon bite. Now, the first priority would definitely be to clean the wound with soap and water and then have an immune globulin. So viral meningitis requires standard precautions. So a common cause would be your West Nile virus, which is transmitted by a mosquito. So it's very important that we implement standard precautions for patients with viral meningitis. Compare that to a patient with bacterial meningitis who is usually placed in Droplet Precautions. Now, shingles is a viral infection. The first symptom would be painful rash. So the priority problem could be about pain. So it's caused by the varicella zoster virus, the same virus that would usually cause chickenpox. So remember the 3F in shingles: fever, fatigue, and fluid-filled blisters. There's usually a vaccine for its prevention, Shingrix. So hepatitis C is a blood-borne disease. It's usually common to people who had transfusion and those who have been injected with infected needles. Now, it is curable, but currently there is no approved vaccine. So it can also be present in patients with multiple sexual partners and men having sex with men. Next, Giardiasis is a diarrheal disease common among travelers. So it could be transmitted by contaminated food and water and through anal and oral sex. So there's usually watery, foul-smelling, soft, greasy stools. So the treatment would usually metronidazole. Next, Salmonellosis is a bacterial infection that could be transmitted through fecal-oral route or infected food, milk, or eggs, specifically turtle eggs, and even half-cooked pork and beef. So the treatment would usually involve your ciprofloxacin, and the first line of treatment for children would be your azithromycin. And then we have your Lyme disease. Note the characteristic bullseye rash or rounded rings of rash. This is also known as erythema migrans. Now you have to assess if the patient have been to the forest or have been exposed to deer ticks or they have been to wooded areas, and it's usually treated with doxycycline or amoxicillin. Next is tularemia. It's caused by Francisella tularensis, or this is usually known as rabbit fever. So it's transmitted by your deer flies, and it's very important to remember it causes FSC, fever, and then swollen glands, and of course chills. It is treated with either gentamicin, streptomycin, or doxycycline. That's the end of our first PECHA KUCHA. So this is your mentor, Ray, your fact check buddy, saying thank you. That was fun and that was fast. I hope you were able to listen, and you can play the video again for your recall and retention. See you in our next video. So let's learn together. Send in your request to my email, mentor.raygapuz@gmail.com. So it's a very important class for you to remember those facts that we have actually covered in this PECHA KUCHA activity. So once again, this is your mentor, your fact check buddy, saying a functional concept a day keeps your NCLEX-RN fears away. That's coming from me. No other. Okay. See you in the next PECHA KUCHA. I hope you had fun. I had fun. I wanted to say more, but we are under time constraint. Once again, a functional concept a day keeps your NCLEX-RN fears away. See you in the next PECHA KUCHA.